Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Couple things before we go to Dr. Fine. First up, I want to thank Rebecca Cotto da Silva for Skyping in this morning from Bolzano, Italy, giving us the update. Holidays coming this weekend, and the country is going to start rolling back lockdown in significant steps starting on May 3rd and May 4th. Italy has over 25,000 deaths tied to the coronavirus. So we'll continue to track that and continue to have her as a guest every Friday going forward. Also, it is official and not a surprise. Rhode Island interscholastic sports have canceled all spring sports for this year. Obviously, a huge disappointment for young student athletes, some who are college bound and may still be getting recruited. So a sad note as another element of our life gets swept away as we deal with this crisis. Let's go to Dr. Fine. Dr. Fine, thank you so much for joining us again today.
Good afternoon, Josh.
So lots of news. Let's first go to the numbers, and they are again disappointing and impact literally millions of Americans across the country between the number of folks who have tested positive and then the number of people who have lost loved ones.
Millions of Americans and millions of people around the world. 2.76 million people tested positives around the world, approaching 900,000 in Rhode Island, 889,000. We are likely to cross 1 million middle to the end of next week of new cases that are tested positive, increasing in the United States 37,000 or so a day. Around the world, first, the thing I forgot to mention is 762,000 people around the world have recovered. So 750,000 people have gotten this disease and recovered. That is in the cards, thank goodness. Recovery is likely. 193,000 deaths around the world. We will likely cross 200,000 deaths today. And 50,000 U.S. deaths now, increasing by about 2,500 a day, a pretty robust increase. 6,256 cases tested positive in Rhode Island as of yesterday, 415 or so new cases, 267 people in the hospital, 72 in ICUs. Our hospital numbers continue to hold steady, and that's amazing and a good thing and a testimony to everyone's compliance with social distancing. 8 deaths yesterday, up to yesterday, unfortunately 189 deaths in Rhode Island so far. That number, I'm afraid, will continue to climb 10 to 20 a day over the next week or two at least, and I think more likely over the next month.
It was a record number. We've had in the last 3 days, we've had our 2 highest numbers of new test results. I did get notified from a friend who went to the CCRI testing, which CCRI requires, that location, the college locations run by the National Guard, require a doctor's assignment, that there was no one at that facility getting tested. CVS, you can go to their website and sign up. Do we need to dial back this requirement at the CCRI, URI, and RIC campuses to make that more like the CVS campus?
I would very much like to see us dial back the requirement for doctors order to test. There's been some dial back, and I think we're beginning to allow EMTs and nurses to order, and that's a good thing. I'm trying to confirm that, but I think that's a good thing, but I think we should dial it back altogether. There's adequate control that can be constructed in the process of scheduling a test. We can get all the information we need out of the scheduling process, and that would let more people get tested and get tested quickly. The concern classically is that if there's a process, if there's a test and no doctor administered it, or no doctor ordered it, then there's no one responsible for delivering the results. So as one thinks about this, one would need to come up with a process for notifying people of results, and then making sure that they got into isolation and got this family support they need. And eventually get contact tracing if we think that's doable. But I think what we ought to be doing is getting rid of or changing the requirement for doctor's order for testing. And make it so that the solution actually addresses the problem instead of using the historical broad brush we've used with other kinds of lab tests. We are in a different time with a different disease, and we need to respond to that appropriately.
The Department of Health, after I think two factors, relentless media inquiries, certainly by GoLocal, and I do believe some other news organizations, but then also a decision by CMS to report the number of cases at all nursing homes. The Department of Health yesterday finally released the number of cases ranged by nursing home and the number of deaths. The number of nursing homes that had previously been released was 20. That number jumped up to 31 now that they are reporting cases of less than 5. 31 nursing homes, all with positive cases, many with deaths, some with as many as 20 and 30 deaths. Do we have the right strategy at nursing homes?
Man, it's hard to figure out what the right strategy is. I think there's going to be huge attention to nursing homes. That's what I'm hearing over the next week or two, whole new strategies. But Josh, I can't tell you that this is going to be a doable thing because of the character of this virus. This is a virus that's hard to control in congregate settings. And it gets at the question of, really, can nursing homes ever be made safe from infectious disease? I'm not sure the answer is yes. So the right question may not be, do we have the right strategy? The right question may be, can we support people living in nursing homes in this way and ever keep them safe from the spread of an infectious disease like this?
We seem to have developed, though, thoughtful strategies, at least in the planning process of how a restaurant might look in the future. Well, listen, why aren't we, if there's 30 people in a nursing home in one of the smaller, more family-owned structures, why hasn't that been narrowed down, taking those who have the most mobility out of that environment, moving them to the convention center where no one is deployed but the facility is ready? Those that are, based on physicians' consult, most able to deal emotionally, health-wise, to move and get them out of what we know, for the most part, is a failed environment that is highly contagious for the most vulnerable people to this virus.
It's tough and confusing because every time you move people in nursing homes out, you have your own set of risks, including huge emotional risks. Getting people who are, who have ranges of cognitive ability in a new situation where that they may not be emotionally adapted to, has its own risks, and those are real. The other problem for us, I think, is that we have under-resourced this whole process. Remember, the Chinese in Wuhan brought in 43,000 new healthcare workers to work to contain it. The Israelis, in Bnei Barak, brought in 2 battalions, I think, of reservists. We got 1,000 people activated in the National Guard around the state, but I think that's a small percentage of the people we would need to do what you're suggesting if we decided that what you're suggesting is safe. It may be that what we need to be doing is not just redesigning restaurants, but redesigning the nursing homes of the future. Thinking about this from an infection control perspective as much as from a financial perspective, which is how it's been done before.
We seem to have, one thing we know is if you leave them in those environments, they're at a very, very high risk. Facilities with a couple hundred patients are seeing deaths as high as 30, 15% of the population. It would seem that at least a strategy that would be worthwhile exploring is moving those that can be moved based on healthcare decisions into an environment to minimize their exposure, and understanding that there are going to be some risks there. We've proven what the risks are for staying in a contaminated facility.
Well, it's certainly worth studying different approaches. The Department of Health is fantastic about working with nursing homes and helping control the spread of other diseases, but it's time to admit that this is a different disease. This is not like what we've done before. This is not like influenza. It's not like tuberculosis. We got to recognize that when you've seen one disease, you've seen one disease. We are understanding that this is a sneaky, difficult, mean disease, and we need to build a response to it that's different than the response we build for tuberculosis, difficult than the response we do for flu or pertussis, which is whooping cough, or rotavirus. There are 100 different approaches we've created over the years that work a little bit, but we need something new, different, and as far as I'm concerned, way more robust if we're going to bring this one to heel.
You're on the front lines in Pawtucket and Central Falls, dealing with the spread, the exposure, trying to control quarantines. You've had discussion with law enforcement in that area. They're feeding you back very deep concerns about how law enforcement should deal with some issues and questioning what direction they're getting from the state level. Talk a little bit about what you've heard from police officers in those communities.
Well, first of all, I've never seen better teamwork and better collaboration with law enforcement than I'm seeing in those communities, particularly in Central Falls. They want to help enforce the quarantine. And in Central Falls in particular, we're hearing about people who are ill with the disease, are positive, and are breaking quarantine. And we would like to be able to help remind those people of their responsibilities, but the police department is feeling like it's not getting adequate information. It's not getting, they have no way to confirm information. They have no way to get telephone numbers because they want to make their outreach telephonic at first. And they feel like they are at a distinct disadvantage in helping support this response. So, we're also beginning to look at temperature screening, and there's a whole range of legal superstructure or infrastructure one needs when you begin to think about enforcement when you do this kind of stuff. So, right. In the quarantine example, so somebody's breaking quarantine, can we arrest them? Can we move them into involuntary isolation? Can we give them a fine? All of this appears to be poorly defined at the moment, and I'm hoping we'll get to find a little bit better and a little bit better quickly. A colleague, an old friend, over the night sent me, somebody had found in the historical archives in Cleveland, Ohio, where I went to medical school. They had found a directive from the director of the Department of Health in 1918 during the Spanish flu. And what was really interesting about that directive, which basically was the directive that closed everything, was that it came from the director of the Department of Health, not from the mayor or the governor or the president. It was a time in which the public health authorities had the authority to act and act clearly. And I think we probably ought to think about bringing that time around again, because once you get 37,000 different players involved with trying to figure out the political ramifications and the this and the that, all you're doing is burning time as the virus marches forward into the population.
Last issue, I had not heard of the strategy of consuming cleaning liquids in order to combat this. I think both of us have read a tremendous about the science behind this, but the president suggested that certain cleaning items might be the proper strategic approach to combating the coronavirus. Have you read any papers about the president's utterance that supports his suggestion?
Well, the president doesn't usually doesn't provide references to the scientific literature when he speaks. So I am anxious to see those references and have the opportunity to read the original papers and make sure that the quality of the research is adequate. Let me leave it at
that. Maybe he was just trying for a little levity and trying to bring the country together. And he did bring the country together. There's absolutely unanimous belief that consuming things like bleach, Clorox by brand name, would not, or Lysol would not be a benefit to an individual. In fact, would probably have a significant negative impact on their health. Dr. Fine, what else do Dr. Fine, what else do people need to know today?
Keep doing what you're doing. Go into isolation the moment you get a symptom. Make a phone call, but the moment you get a symptom, go into isolation. If there are other people in your house, put a mask on, get them to mask, make sure nobody leaves the house for 2 weeks, and call for support and help as you need it. There's now pretty good help and support getting people food in isolation so they don't have to leave their house. I haven't figured out what people in isolation ought to do about their dogs and getting their dogs walked, but as far as I'm concerned, it's probably not a bad idea for dog owners to plan for what happens with their dogs when they get sick. But outside, keep doing what they're doing, staying safe, and hopefully we'll have a nice day tomorrow so that people can go outside, get some exercise, 6 to 8 feet apart.
Dr. Michael Fine, thank you so much. As always, again, from a programming note, 2:30, not 1 o'clock, 2:30, Governor Gina Raimondo. And again, she will not allow reporters to directly ask her questions or follow-ups that the public can hear. And for everybody else, stay tuned. GoLocal's working on a couple significant stories. Stay tuned for those, and new numbers are coming out of the state now. Thanks, everybody. Please stay safe and enjoy the weekend.
Thanks, Josh.